My name is Tiffany Landis, and I'm going to talk to you about the dangers of childhood obesity. Did you know that childhood obesity has more than tripled over the past 30 years? A recent study shows almost half of children in the United States don't get at least 30 minutes of exercise daily. In 2008, children ages 12 to 19 who were obese increased from 5% to 18%. In a population sample, 70% of 5 to 17-year-olds showed increased risk of cardiovascular disease. Obesity leads to long-term health conditions such as stroke, heart disease, diabetes, many types of cancer, such as pancreas, breast, and colon cancer, bone and joint problems, sleep apnea, social and psychological issues, and high blood pressure. Obesity affects the child. They get made fun of at school. It gives them a low self-esteem. Children who are obese are more likely to be obese adults, and they have existing health issues or will develop them due to their weight. Does TV affect childhood obesity? Absolutely. According to the book Scale Back, while childhood obesity is not just about weight, TV is a problem because kids are inactive while they watch it. The food commercials that come on while children watch TV make them hungry, so they eat junk food as they watch it. Reading books, drawing, and coloring use more energy than watching TV and also stimulate their brain. Where do you start when dealing with an obese child? The book Scale Back, While Childhood Obesity is Not Just About Weight recommends the doctor's office. Ask what your doctor recommends if he or she worries your child is obese, and discuss your options. Consult your doctor about putting your child on vitamins. Who's to blame? Some people have gone as far as to blame fast food restaurants like McDonald's for their child's obesity. How can you blame a restaurant if you're the one who's buying your child the food? If you don't want your child eating fast food, then don't buy it for them. According to Fed Up, Winning the War Against Childhood Obesity, many experts recommend banishing regular soda drinking from the household because they're a major source of added sugar. Children should be encouraged to drink water when they are thirsty. A child's risk of being obese increases if the child is poor. Obesity in adults is the second cause of preventable death in the U.S., second to tobacco. Other information from Fed Up, Winning the War Against Childhood Obesity. In 2004, the CDC published an estimate stating that the annual toll of obesity and inactivity at 400,000 deaths yearly. The same survey predicted that obesity would soon overcome smoking as the leading cause of preventable deaths. Direct and indirect medical costs of obesity were currently consuming 10% of the United States healthcare budget. Healthy lifestyle habits decrease the risk of childhood obesity. Methods of prevention. Eating healthy. Cook at home so your children can get vegetables in all 5 of the food groups. Exercising. Play outside with your child, or at least watch them play for at least an hour or 30 minutes. Picking a good school. Make sure they are learning ways to be healthy and are getting plenty of exercise and PE. The 7 steps to a healthier weight loss. This is from the book Underage and Overweight. It states 7 steps to a healthier weight. The first one is normalize activity. Just give 30 minutes a day to exercise. The second one is normalize eating. Have 3 meals a day with only 1 or 2 snacks. Try to eat one meal as a family with no other distractions. Balance sound nutrition. Normalize eating patterns and try to stick with daily recommended servings of each food group. Number 4 is feel good about yourself. Know what's going on in your child's life, good and bad. Encourage them to be active in extracurricular activities and help avoid being negative. The fifth one is communicate feelings. Talk about your feelings and give your kids advice, but let them solve their own problems. Number 6 is feel good about others. Develop good relationships with peers and other adults. Promote acceptance of people who are different. The last step is balance the dimensions of wellness. Avoid any kind of substance abuse. Consider any intellectual, spiritual, emotional, and social changes. The summary: by changing a few habits, you can change your child's life. Be active in your role and help your child prevent obesity or turn it around for your child. Obesity in some cases is genetic, but with choices and adequate exercise, it can be overcome.